Imagine the following scenarios.
Johnny, hurry up. It's almost time for the bus.
Jean is taking care of her 8-year-old grandson, Johnny, while his parents are out of town. While Johnny is on a school field trip, he complains of stomach pains. After an examination at the ambulatory clinic, he is rushed to the hospital emergency room. The clinic secretary leaves a message asking for Johnny's parents to call her immediately. When Jean returns the call, the receptionist won't discuss Johnny's condition or his whereabouts.
Johnny's grandmother. I got a call that something was wrong with Johnny.
I'm sorry, ma'am. Because of federal regulations, we're not allowed to give out any information on patients.
Oh, nurse? Oh.
What if during a routine office visit, your mother suffered heart failure and has to be rushed to the hospital, but the receptionist couldn't tell you anything about her condition because you weren't specifically listed as a person with whom she could discuss the patient's condition? What if you didn't get there in time to say goodbye? Or what if this real-life incident happened to you? A man dies in the hospital after a traffic accident just minutes from his home, and his family was not informed, even though he was carrying identification. When asked why they had not notified the family, hospital authorities said,
"Federal confidentiality regulations prevented us from doing so."
Welcome to HIPAA training. That's the Health Insurance Portability and Accountability Act of 1996. One key reason for this training is that healthcare providers, health plans, and healthcare clearinghouses, so-called covered entities, are required by law to follow the HIPAA privacy rule.
Many healthcare professionals are still unclear about what the privacy rules, both federal and state, require them to do to safeguard patient information, and misinterpretations of the rule are affecting the quality of patient care. Another reason for this training is HITECH, the Health Information Technology for Economic and Clinical Health Act. HITECH expands the HIPAA privacy and security protections and includes additional patient rights, new requirements for business associates, new breach notification requirements, new marketing provisions, and stiffer penalties for noncompliance.
How can we be sure we're doing the right thing?
In simple terms, the HIPAA privacy rule is all about building trust between you and your patient, so the patient can be confident you'll do the right thing. The rule restricts the use and disclosure of medical records, and it gives patients more control over how and when their personal records are used. The record trail, whose hands it passes through, and why.
Protected health information, or PHI, is any personal information, oral, recorded, on paper, or sent electronically about a patient's physical or mental health, healthcare services, or payment when it connects the patient to their records. A name and address, for instance, or social security number, or physician's notes are all protected.
One of the biggest areas of confusion is figuring out exactly who healthcare providers can share confidential patient information with. Think minimum. You limit use and disclosure of PHI inside and outside of your facility or agency to the least amount of information necessary to get the job done right, except when it comes to treatment for obvious reasons. Healthcare providers need access to the entire record to provide quality care. For instance, this nurse and a behavioral therapist are talking about a patient. Permitted. A secretary scheduling a surgical procedure. This is a permitted use for treatment. Use and disclosure of PHI is also permitted for payment, claims billing, or to obtain review services for coverage or medical necessity, and the day-to-day operations necessary for healthcare delivery. You are also permitted to use or disclose protected health information for incidental uses too. That includes waiting room sign-in sheets, or physicians talking to patients in semi-private rooms or conferring at nurses' stations without being overheard by a passerby. And you're permitted to use or disclose a patient's PHI when that person requests or authorizes it, except psychotherapy notes about private counseling sessions, any information that may have potential use in litigation, or that could endanger the health or safety of the patient, staff, or anyone else.
This
If a patient requests his or her records, your facility must take action within 30 days and document receipt of the PHI requested. Under the HITECH Act, patients have additional rights. Covered entities must agree to patient requests to restrict disclosure of their ePHI if the disclosure is to a health plan for purposes of carrying out payment or healthcare operations, not treatment, and the provider has been paid in full for those services. This provision addresses consumer privacy concerns that individuals might not want their insurance companies to know about certain healthcare services because that knowledge could affect the individual's insurance rates or insurability. The patient's right to access his or her own health information is also expanded by HITECH. The privacy rule allows patients to receive an accounting of all non-routine disclosures of their health information. Under the HITECH Act, patients can request an accounting of routine disclosures of their electronic health records, those used for treatment, payment, healthcare operations, and those authorized by the patient for the prior 3 years.
When is authorization not required? Your facility's rules may differ, but generally this includes to control and prevent disease, to report victim abuse, to monitor the safety of FDA-regulated products, for health oversight to ensure quality care, for certain law enforcement purposes, for coroners, medical examiners, funeral directors, and tissue and organ donations, or to comply with a HIPAA investigation.
HIPAA permits use and disclosure of PHI without written authorization, but with patient agreement to maintain your agency's patient directory or inform appropriate agencies during disaster relief efforts and inform family members or other persons involved in patient care. Patient agreement is also required to inform family members or other identified persons involved in the patient's care or payment, or notify them on patient location, general condition, or death. Written authorization is not. What if the patient is unresponsive when brought in? Does HIPAA allow you to respond to questions from family members? Follow your facility rules, which may differ from federal regulations, and trust your professional judgment. Ask yourself if it's in the best interest of the patient. You want to do the right thing. That's how you build trust between you and the patient, and that's what HIPAA and HITECH are all about. Sometimes you have to disclose PHI without permission. Sometimes if you don't, it could endanger a patient's life. Remember, your patient needs to be confident that you can be trusted with their sensitive information. Isn't that what you would want for yourself and your loved ones? HIPAA also requires a designated full or part-time privacy official responsible for implementing the programs and a contact person or office responsible for receiving complaints. When you have questions, this is the person to go to with any issues you don't understand. And the Department of Health and Human Services is mandated to give you and your organization advice and technical assistance and help you work out problems if you inadvertently make a mistake. For all other uses, a signed authorization from the patient is required to use or release the patient's PHI.
Consent for routine health care is optional, although your facility rules may differ on this. But signed authorization forms like these are required for use and disclosure of psychotherapy notes about private counseling sessions, except for treatment, of course, or payment, or day-to-day healthcare operations. Authorization is also required before using or disclosing PHI for marketing, anything used to encourage people to purchase a product or service, or for selling patient names and addresses to third parties.
Exceptions would be when you tell a person about services like smoking cessation classes, or about a specialist for follow-up tests, or when you suggest a massage for stress relief or other alternative therapies. And health plans can inform patients about services such as discounts for prescription drugs. That's not marketing. That's about better care. The HITECH Act imposes more restrictions on the sales and marketing of PHI without patient authorization. Covered entities and business associates are prohibited from being paid to use PHI for marketing purposes, except in limited circumstances involving research or public health activities or communication to a patient about a drug or biologic the patient is currently being prescribed. Authorization forms differ, but generally include a description of the PHI, who will use or disclose it, why, and whether disclosure will result in financial gain for you, the covered entity. Included is also the patient's right to revoke authorization, how he can do so, a signature and date of signing, and expiration date. After that date, you're required to get a new authorization. And make sure the patient receives a copy of the form.
You're welcome.
The HIPAA privacy rule also gives patients, meaning you and me as well, the right to make informed choices about how personal health information is used. The key word here is trust.
If the patient is confident that she can trust you, then communication is better. And good communication is the foundation of quality care. So it's your job to handle that sacred trust responsibly. Your written privacy notice outlines the facility's privacy practices about use or disclosure of PHI and facility legal responsibilities. Was the patient told to just sign it without reading the fine print? Did he think it was just another one of those medical forms? Remind him it's in his best interest to know his rights and make sure he signs off. Or document reasons why it was not obtained. Was the patient told how to lodge complaints, as well as the name and number of the privacy officer? Remind him that it's all there in the privacy notice. Read the fine print. Notice of your facility's privacy practices should also be displayed at the site of service and, when possible, posted on a website. And new notices must be issued when privacy practices change. Patients can also have PHI communicated to them by alternate means and at alternate locations to protect their confidentiality. That's your job. That's your role in HIPAA. Patients can request inspection and amendment of PHI and obtain copies of PHI, and there are no limits on the number of times they can make a request. However, you do have the right to ask that the request be made in writing. Use your professional judgment. If for any reason you believe the information could cause harm to the patient or endanger staff or anyone else, you do not have to agree. If you do deny access to PHI, you are required to give the patient a written explanation of the reason and a description of how the patient can complain to your facility's privacy officer or directly to the Department of Health and Human Services. Patients have a right to file a complaint regarding any privacy concern or breach of privacy both within the facility and with the Department of Health and Human Services. Make sure you document complaints of privacy breaches as well as their resolutions. The HITECH Act imposes more stringent requirements in the event of a breach, the inappropriate or unauthorized use or disclosure of patient health information. The privacy rule has no requirement to report privacy breaches. Covered entities must notify patients when their unsecured or unencrypted PHI has been compromised. That includes unauthorized disclosure of PHI to outside third parties, as well as unauthorized internal access to PHI. Exceptions include unintentional use or incidental disclosure by employees or authorized individuals within the same facility. Individuals must be notified without delay and within 60 days after the breach is discovered. If more than 500 people are affected, the covered entity must notify the Department of Health and Human Services and local print and broadcast media outlets. HIPAA established the first civil and criminal penalties for violations of the privacy rule, and the HITECH Act increases those penalties. HITECH creates a tiered increase in civil penalties tied to level of intent and neglect, from HIPAA's $100 per violation not to exceed $25,000 to $50,000 per violation not to exceed $1.5 million per calendar year for the same type of violation. Business associates as well as individuals will be subject to the same criminal and civil penalties as covered entities for violations. In addition, a state's attorney general can bring civil actions against a person on behalf of patients adversely affected by violations of HIPAA or the HITECH Act. What about patients who can't exercise their rights, legally for instance, or patients who are incapable of exercising their rights? Or suppose a patient designates another to make healthcare decisions on their behalf. For instance, a court-appointed legal guardian of a mentally or otherwise incompetent patient, or someone with legal authority to act on behalf of a deceased patient or his estate. In these cases, a designated personal representative can exercise all the rights that apply to the patient and have full medical authority to make all healthcare decisions. But a personal representative may only have power of attorney regarding use of artificial life support in a medical emergency, and therefore only have the right to the PHI needed to make that decision. What about the privacy rights of minors? Generally, parents can access and control the protected health information of their minor children, except in situations when state law overrides parental control. Examples include HIV testing of minors without parental permission, or in cases of abuse, or when parents have given up legal control of their minor child.
Healthcare professionals have been protecting patients' privacy since the Hippocratic Oath. You promise to do no harm, and that means every patient entering your facility needs to be confident you can be trusted to do the right thing on all fronts. Guarding sensitive information is just as important as guarding a life. Unfortunately, the healthcare industry is big business. Sensitive healthcare information passes through more hands than ever before.
To lenders, for instance, who could use that information to deny a patient's application for home mortgage, or to prospective employers who could use it to make personnel decisions. That's why HIPAA and the HITECH Act were enacted. Yet stories abound of patient families who have difficulties obtaining information about their loved ones due to misinterpretations of the HIPAA regulations. And some patients who are misinformed are so overprotective of their medical records, they restrict disclosure of their PHI so completely it compromises their care. An example is an elderly patient who unknowingly checks a box indicating she doesn't want her information released to anyone. In the process, she inadvertently prohibits healthcare professionals from contacting a family member unless an emergency situation arises. Concerned healthcare workers often wonder if they're doing the right thing. For instance, states have rules in addition to federal privacy laws. Which ones do they follow? According to HIPAA, when state laws are contrary to the Privacy and Security Rule, as well as the HITECH Act, state laws preempt or take precedence over HIPAA and HITECH if they provide greater privacy protections or provide for the reporting of disease or injury, child abuse, birth, or death, or for public health surveillance, investigation, or intervention.
First, make sure you know the facts. Get familiar with your state laws and your facility rules, as well as the HIPAA requirements. Make every effort to comply. When the situation isn't in the rulebook, ask for help. That's what the privacy officer is there for.
But keep in mind that you're dealing with people, and those people are counting on you to do the right thing.